Hey guys, this is Dr. Hub. Today we are going to look at the clinical features, and this is going to be of the atrophic rhinitis. So here, first we need to know that the atrophic rhinitis, where is it more common? It is more common, MC. It is most common in case of females, and it starts at the puberty. It is basically a bilateral condition. So these are some important terms we need to know. And then moving on to some of the symptoms. So what are the symptoms of this atrophic rhinitis? So the symptoms is that it is foul smelling. So there is foul smell, and this is from the nose. Next is there is a nasal obstruction. There is presence of nasal obstruction in spite of a roomy chambers due to the large crust filling the nasal cavity. So there are presence of large crust which fill the nasal cavity. Next, moving on, there is also presence of epistasis. This is all in case of atrophic rhinitis. So there is presence of epistasis, there is a bleeding. This is due to removal of crust, due to the removal of the crust. Next is there can be presence of anosmia. Anosmia. This is due to the degeneration of the nerve elements. So the nerve elements are degenerated. And this is nothing but it is also known as a merciful anosmia. Next we move on to the signs. The sign is they are greenish, they appear greenish, or they also appear grayish. So it's greenish or grayish, a black dry crust. So it is a black dry crust. And what does it cover? It covers the turbinates and the septum. So it covers the turbinates as well as the septum. Next comes after the removal of the crust, first on removal what happens is the removal of the crust. So the nasal cavities appears roomy and with the atrophies in the turbinates. So the nasal cavity, it appears roomy as well as with the atrophy of turbinates, Next, another important point is that the nasal mucosa, how does it appear? It appears pale. That is, the nasal mucosa, the appearance is pale. So this was all about the atrophic rhinitis and its clinical features. To learn and grow daily like this, please do subscribe.